My name is Brianna Krennerich, and this is my second equine massage evaluation. Behind me we have Brody. Brody is a 10-year-old Morgan quarter horse cross. Right now he has my magnetic blanket on him. I did ride him earlier, about half an hour ago, and then I put this blanket on when I was done to kind of help with the blood flow through his muscles, help relax him. That way we can get ready to do this evaluation. So what I'm going to do is I'm going to take his blanket off, I'll move him around, I'll kind of evaluate his gaits, I'll go start with the palpations and then the massage. I'm going to rotate my camera, that way you can see his movements. First, I'm just going to ask him to walk so I can take a look at his gait. He tracks up at the walk, slightly behind. There, he's tracking up underneath himself well. Let me grab my side. Then ask him to walk this direction. He's tracking under himself. He's not really extending his front legs like I would like to see. He does trip quite often on that right front. He tracks behind at the trot. He's got a pretty choppy in his front legs. Doesn't drag his front legs, but definitely doesn't like to pick up his feet. Going to the left, he likes to hold his head to the outside, so I wouldn't be surprised if there's some range of motion, imbalance in his neck. He does also have a spot here on his neck that always gets super sweaty. Now, whether that's tissue damage, muscle damage in the past, the owner doesn't really know. He's fairly new within the last 9 months to his owner, and he's here just kind of for a tune-up and see where he's at. So he always sweats right here, even in his paddock So I think there might be some tissue or some skin trauma from his past, which is why it always sweats and why this is the first place he sweats. But I'll palpate around to see if I can feel any difference. I'm gonna start by checking his pulse and his heart rate. Heart rate is good. I'm going to check his breathing and his respiratory. Count his breaths. Breathing is good, no abnormalities. No discharge from his eyes, a little bit of clear discharge in his nostrils, probably just from working and previously being ridden. I'm going to see if he'll let me check his gums. Pink gums, which is good. Go ahead and check his capillary refill. Good capillary refill. Check the bend in his neck. Some resistance starting right here. I can fit about a finger and a half gap between his jaw and his C2. More resistance turning to the left. I can't really fit my fingers in that space at all. There's a pretty hard knot there, so I'll spend some time working on that. Nice soft muscle around his pole. And then now I'm going to tie him up, readjust the camera, and check his other range of motion. Good motion in his fetlock, no resistance in his knee. No resistance in the shoulder. Fetlock is good. Hop feels good. Good movement in his stifle. I'm going to go and do the same thing on the other side. Good movement in the fetlock. No resistance in the knee. No resistance in the shoulder. Good movement in the fetlock. Good movement in the hop. Good movement in the stifle. Now I'm going to palpate. Got a little bit of a stressor point right here at the top of his brachiocephalic. He kind of wants to move away from me. Palpating down the tricep. No reaction down his longissimus. No reaction down along his ribs. Got a little bit of a tight part of his glute here in his mid glute. The upper part of his glute is nice and pliable, and then it gets a little harder through that midsection. Nice pliable hamstring. Go through and palpate along the other side. He doesn't like that. He wants to move his head away from me every time I push down at the top of that brachiocephalic. His whole brachiocephalic is rather hard. Not much movability in it. All the way down to where it goes behind his shoulder. Really tense, hard muscle. That's nice and loose. His crest feels rather hard. So I'm going to spend some time picking and squeezing his mane, rocking back and forth. That's already getting a lot looser. Palpating down. No reaction down his longissimus. No reaction along the ribs. Even butt muscle. Even glutes in terms of pliability all the way down. Nice loose hamstring. Bottom of his glutes is a little tough. I'm going to start by doing effleurage all across his body. I have a slick hair, but then I also have a sleek easy. And these sleek easies, these have little prongs to kind of help clean them up. I like using this to help with the effleurage strokes, just to calm the muscles and really get that connective tissue nice and soft. So I'm going to start up top, just work my way down. It is a de-shedding tool, but I love it to kind of help get the areas warmed up. Working my way down. here, but I want light pressure, enough to go across. He's licking and he's chewing. Just going along down his body. Essentially what you would do if you were to just set him out. Get him nice and clean and prep for the massage. Spend a little extra time over the area that is nice and tough. Really see if we can break that up. Same thing on the other side, starting at the neck. Down at his pecs. Working my way down his longissimus. Nice, long, even strokes. And then over his glute, I do even, short strokes. He's cocked his heel for me. Down his hamstrings. So now I'm going to start his massage. I do also have my 8-ball machine gun from Equine Relief. It has 4 different levels. I'm going to just use level 1 on the right side of his neck, kind of as a maintenance. The left side of his neck was where it was super, super tight. So I'm gonna use a level 2 on that, and then I'll use level 2 on his butt as well. So I'm going to start at his neck. I'm gonna do 5 minutes on his neck, and then I'm gonna work my way down his leg, down his back, to his hind end, and then on to the other side. So it does have an infrared light in the center. So what you do is you put it on them and you do nice even strokes all the way down. Before they're introduced to it, I just like to turn it on, let them hear it, let them smell it, let them touch it. I touch them maybe with the back side of it so they can feel that vibration. And then I go ahead and I start. When I first introduce them, I go a little faster with my strokes. This is his first time ever being introduced to the massage gun. He's not sure about it up here quite yet, so I'll just kind of stick with him. You don't want it on the bone, so I'm just right under his vertebrae on top of that brachiocephalic. Working my way down, a nice slow motion. massage gun kind of represents a small vibration, compression, and at the higher levels, even a beating motion. He's licking and he's chewing. He just let out a nice big exhale. Working my way all the way down that brachiocephalic. Running along the outside of his shoulder blade into that little area that he sweats. I won't spend too much time in that area just because I don't know the damage is actually underneath or what's going on there. Spend some time going down the crest of his neck. Some more licking and chewing. Down to about where his withers start. Then back up again. We're about 2.5 minutes in, so I'm going to do some F-fly strokes and just relax that muscle in between. I can already feel his neck is a lot softer. He's kind of got a little stress knot right here that I can feel now instead of just all of it. And it looks like it could have just be from a bite mark as well. But I'm going to place that infrared light on that area for a minute and let it sit for a second. He's leaning into the gun. I can feel his pressure against me. Still nice steady breaths. Do some more F-fly strokes. Going to do some compression circles on his pectoral muscles. He kind of doesn't have much for pec muscles. It's there, but it's super jiggly, kind of like a soft jello. So I'm hoping as he works more and as he conditions his body, those will harden up just a little bit and get some strength to him. That could be why he doesn't like to pick up his front feet very well. Those pec muscles aren't helping his shoulders at all and aren't helping that front end. some friction and vibration on the trapezius. And this tricep. You can even use the massage gun on the tricep as well, but it's nice and loose, so I'm just kind of doing a little bit of maintenance in that area. I'm going to lift and hold as I work my way down his front leg. He's not so sure about that. I'm going to lift and hold. Lift and squeeze as I work my way down. My fleurage strokes. Lift and squeeze. Work my way down his back. I'm going to do some ringing. Like that. Using my palm and my fingers. See if we can get a tummy tuck. I'm going to lift up that belly. Kind of lax the top line. I'm going to do that 3 times. Friction along his back, or not his back, his rib cage. Then I'm going to use the massage gun on level 2 along his glutes. Again, show it to him. Let him feel it. Slowly work my way down, starting at the top of his glutes. I like to see that the vibration is going through his entire muscle. About here, it stops moving the other muscle, so I'm going to camp here for, 15, 20 seconds. And then continue to work my way down. Nice long stroke. Making sure to stand to the side just in case they feel funny about it being back on their hind legs. I like to go on an angle, that way it hits every part of the muscle, versus if you go parallel to them, you're kind of missing a strip in the center. So you're prepping the muscle, it's getting that infrared light, and then you're hitting the muscle again. Calling to his friends. Here I don't want to go on the stifle, so I'm just going off to the side, working my way down. Where you only have 2 balls on them now as you slide down that muscle. Effleurage strokes along that whole butt. Checking it a lot more pliable. I can move that whole butt muscle now. He's licking and he's chewing. Just gonna do some compression circles down this low muscle here, because this was still kind of tight. Much better. It's already loosened up quite a bit just from those compression circles. And then the squeezing. He's licking and he's chewing. Nice soft muscle. And we're gonna go through and do the other side now. So here I'm going to spend some time with my fingers just massaging this area behind his TMJ. Not a fan of that, I'm just putting pressure and doing nice small circles. Now that I'm here, I'm going to check his TMJ. See if we can get him to open his mouth. Good movement in the left TMJ. Good movement in the right TMJ. Feel that knot loosening, so I'm putting pressure and just some small circles with my thumb. Definitely an area that I'm going to recommend a chiropractor come out again and adjust him. I can now fit about 1.5 fingers through there, but it's not quite as much of a gap on the other side as this side. Work my way down with some F-flash strokes. This is the side of his muscle that is super tight, so I'm going to do a level 2. Start at the top, along the crest of his neck, behind the C1, that way you're not hitting the wings of his atlas. Now I'm working my way down along his brachiocephalic, turning my gun parallel instead of perpendicular. Or sorry, perpendicular instead of parallel to his neck. Get that whole muscle. Let the infrared light go in between the balls. He's licking and he's chewing. pushing into me, pushing into the gun. So I'm going to camp here for about 15 seconds. I like that he's willingly wanting to bend his head more this direction. I'm going to do the last about minute or so for his neck down that brachiocephalic. Nice big exhale. Licking and chewing. Opening up deeper so I can get in there for a minute. It's trapezius. Do some friction. Nice movement, kind of feels like Jello. This pec feels a lot. It's a little imbalanced. There's not as much muscle mass on this pec. I know he does have this foot step forward, but just feeling it. He's got a bigger pec to the right than he does the left. Try to lift and hold, lift and hold. Squeeze, lift, release, squeeze, lift, release, squeeze, lift, release. It's like, aren't you wanting me to pick up my foot? Squeeze, lift, release. A little bit of lift, vibration, lift, vibration, lift, vibration. onto his butt. Level 2, again on his butt. Large strokes after that pass. It's pretty tight starting right about here in that lower glute. So I'm going to camp here for 15 seconds or so. Give them a minute. The wind started blowing outside. Getting pretty, this is antsy for him, the whole, hey, like I want to go, I've done enough of this already. His friends are calling to him outside. I'm going to squeeze, lift, and hold. Do some compression circles. See if I can get him to do a butt tuck. Tail stretch. Also step up against it. Boy. Now I'm going to end with some final stretching. I'm going to make sure that he's in frame. Start to step up. Like that. Reposition the camera and stretch them on the other side. A little resistant to want to stretch this leg out compared to his other hind. Take you for a little walk. Check his range of motion. Much better range of motion. To the right, still a little bit of resistance, but I suggest a chiropractor for that. better range of motion this way. And that is my second equine massage eval. Thanks for watching.